Hi, everybody, and thanks for joining us for our first ever Medicaid Ambassadors Roundtable. Throughout this series, we will be discussing Medicaid and rural areas. And today we have with us Cara and Christi, who are going to talk with us a little bit about how Medicaid affects seniors and elder adults in our areas. So, Christi, let's talk dual eligibility. I hear about questions about this a lot. What is Medicaid's role?
So, hi everybody, I'm Christi. My practice area is in social work. So I've worked in the field for about 5 years in hospice and palliative care social work, and then also as a therapist. And then now I'm back in school as a doctoral student. So that's just a little bit about kind of where I come from and the perspectives that I can bring to our roundtable today. Dual eligibility is, I think it sounds really complicated, and it sounds like the procedure is complicated, and sometimes it can be, but it's entirely possible specifically for older adults to qualify for both Medicaid and Medicare. So when we say dual eligibility, that's what we mean, is that folks can use Medicaid services as well as Medicare. Typically what that looks like is for Medicare, folks might use things like disability or a blind pension, things like that are offered federally. And then for things like, doctor's appointments, help with, prescription drugs, sometimes they can use that with Medicaid as well. So, and then, if folks are living in, assisted living or nursing homes, kind of what you think of as like long-term care facilities, you still can qualify for both there as well. So usually Medicaid will cover room and board in a long-term care facility like a nursing home, whereas Medicare, actually, that's kind of a myth. Medicare doesn't really cover those costs unless it's for a very specific reason. So it is entirely possible to use both benefits.
All right. I think that's really helpful because I think a lot of people do, traditionally think, oh, Medicare is going to cover it when I need to go and be in a nursing home. And then you find out they don't.
Right.
So another one of the questions that I have is when it comes to like aging in place, people who would rather stay home and they're healthy enough to stay home and they don't need nursing care, but they maybe need a little bit of help with their medications, things like that. Does Medicaid cover things like that?
Medicaid can cover things like that too. If we're kind of switching gears from dual eligibility into just using Medicaid, absolutely. They can cover things like that too. And even if someone is, nearing end of life, that's one thing that I think people don't realize is that particularly for end of life care, that can really be, Medicaid can be a really helpful resource if people want to stay home instead of having to go to a nursing facility.
Yeah, I know that's something that we definitely hear, a lot from our elders is that they don't want to go in a hospital. They want to go at home if they can. So I think that's really helpful.
Yeah. And their kids too. Their kids will often say, well, I told mom and dad that I wouldn't do that. And that we wanted to stay home and be together. So.
All right. That's really good stuff. So I've got some questions about, just the process. So if people are already, say they're on Medicare, they don't know where to start. Where do they start seeing if they're dual eligible or if they could get Medicaid coverage?
Cara, I think that's kind of, well, I mean, if you have a social worker available to you, you can find social services designees or a social worker in your health department, in a county health department, or sometimes even small towns have someone you can turn to. Otherwise, if you have internet and feel comfortable applying online, that's really the quickest way to get your application going. You also always have the option of doing a handwritten application. That can take quite a bit longer these days, where everything is kind of digitized. And I know that for me, at least, I like having something like a hard copy of stuff. And so sometimes I'll just like fill it out and then that might make it easier for me to kind of just enter in all the information online as well. But starting online or starting with your local health department, if that's something that you're interested in starting.
Kind of to piggyback off of what Christi was saying, just to introduce myself really quick, I'm Cara. My background, I was a certified application counselor and a licensed navigator. So that means that I used to navigate people through the process of enrolling in Medicaid and helping them find out what other insurance plans they were eligible for through the federal government if they didn't qualify for Medicaid. And now, with the recent Medicaid expansion, we have 275,000 additional Missourians that are eligible for Medicaid, and tons of them have filled out applications. So with that being said, paper is a big, big backlog. Definitely, the state is even encouraging people to go online and, as Christi was saying, to seek out help. So if that's a social worker or a caseworker that someone might have access to, whether that's in a nursing home or at maybe their physical therapist's offices or at their doctor's office that they're able to see, great. But it also doesn't have to be a professional. If you have a trusted family member or friend that can help you go online and can help complete that application with you, the state of Missouri makes that application process very simple so that person can let the state of Missouri know who they are and what their relationship is to you and why they're helping. So that can be a friend, a neighbor. It doesn't even have to be a family member. As long as you trust them to help you proceed and do that information, they can fill that out with you. So that's something that's really important to note, that as long as you are comfortable with that person entering your information, if you're just not comfortable with the computer, that's something, whether you're a senior citizen, whether you're low vision, whatever the case may be, don't let that hinder you. Definitely go ahead, seek out that online application and, ask whoever you're comfortable with to help kind of be your partner and be your advocate in that system.
Okay, I think that's really helpful. And what kind of things should people have on hand when they're applying? What sort of things does the state, need proof of?
Well, that's a really good question, Jamie. For individuals when they're applying with the state of Missouri Medicaid system, it's kind of the basics you would think for most insurance plans. For anything like that, you're going to need the real simple stuff. You're going to need identification that includes your name, photo, and your date of birth. Now, a lot of people kind of get frustrated and they assume, am I going to need a driver's license? Am I going to need a verified photo ID? That can come in many different ways. So if you don't have a driver's license, again, name, photo, date of birth. So that can be something from a college, that can be something from a school if it's for children. There's lots of different things that you can have that will work for means of identification. Now, typically, a state issued ID is going to be preferred, of course, but if you don't have access to the funds to pay for that driver's license or that state issued ID, because that can be a barrier for some individuals, you can use other alternatives. Now, that's something, again, I would probably advise someone to go and ask someone, a certified application counselor at either their local FQHC, that's a federally qualified health center. Those are around rural areas and spread throughout our state, or even their local hospital or primary care office. You can ask them what identification methods they've used in the past. Also, for Medicaid, you're going to need proof of income. So that would be paycheck stubs, Social Security award letter. That can be that award letter that comes for most people January and February. Sometimes people get theirs earlier. And then also tax returns are okay too. Sometimes the state of Missouri will even accept direct deposit proof. So if that money just goes into the bank account and you see that, you're comfortable showing that, there's many ways to show that proof of income. The third item, if you do have other insurance, or if someone in your family, if you're applying for a household, has other insurance, you would need to show proof of that. Even if it's just dental plan or a vision plan. A lot of times in split households where, say, we have a mom who doesn't have insurance, but maybe the children have a father or a parental figure outside the home, that provides their insurance, you would still need to provide that insurance coverage or proof of that insurance coverage for those children, just so the state of Missouri has access to that so they understand the situation with coverage. Or for our senior citizens that are dual eligible, if you have Medicare, you would need to provide that proof of coverage. And then, the easiest thing for most people is the proof of residency, such as a recent utility bill. Now, I say most people. For some individuals, that's going to be hard. Maybe they are in between homes or they don't have a designated address. You're going to need a recent utility bill or something that comes to your post office box that shows your address. Now, if you are in between homes, you would need something where you're getting your mail, where you live as a primary residence. If you are not home stable, there's many organizations that can help you with that, and that does not disqualify you from applying for Medicaid. So please don't think that if you do not have proof of these items, you can't qualify for Medicaid. There are absolutely ways to work around these things, and there are advocates that will help you find these items and advocates that will help you work with the state of Missouri to make these things work. So make sure that you do your best to get these things, but don't let it be a barrier and don't let it be a worry if you don't have access to them.
I would like to add to that, Cara, that if you're a caregiver taking care of, an aging parent, or, you yourself are considering moving into a facility like a long-term care facility or a nursing home, the social services designee is going to be your primary go-to person, and that is your primary place of residence. So even though it seems like an organization or something like that, that is your primary residence. So you can use that address as well.
Okay, that's very helpful. So it seems like there is rather a lot of things that you've got to keep track of. And I know that like my mom is dual eligible, and so she has to fill out a lot of this paperwork a lot. Do you have any like tips or tricks for kind of keeping track of who you've talked to, when you talk to them, that sort of thing?
One of the things that I've found helpful, when I've helped people in this application process is you really want to get the application in as quickly as you can, particularly if you have, medical bills that you need assistance with. Medicaid can actually back pay up to 3 months. So if you're struggling with having some medical bills, maybe some doctor's visits that you just can't get paid, or for whatever reason haven't gotten paid, Medicaid can help with that. So in that case, the most important thing is to get that application in, get it submitted. And so it's 90 days from the date that the application was submitted that they'll back pay. And so having said that, even if you don't have all of these documents at your disposal right this very second, that's okay. The Medicaid office will actually contact you and say, hey, we got your application. In order for us to keep going with this process, we need to have these things from you. And they'll let you know just exactly what they need: verification of income, or, other insurances, or if you have other assets, if you own land, or, a tractor trailer, or things like that. And so they just want verification of those things. Since we are talking about older adults specifically, and like end of life planning and things like that is also included in there. So one of the things that I think concerns older adults that are doing maybe some end of life planning, or kind of starting to think about that, is what about funeral arrangements, or my grave site? I've prepaid for those things. Those things do not count against you in terms of income. So if you've prepaid, or sometimes that's one way to sort of spend down if you have too many assets. That's one way you can prepay your end of life costs that way, and alleviate some stress from your family for having to do that should you pass, anytime soon. So that's just kind of one thing to keep in mind in terms of who to like keep track of. I would just have like a notebook dedicated to, this is my Medicaid notebook, and this is the date, this is the phone number I used, this is the person I talked to, and this is kind of like the gist of what we talked about, and what needs to be followed up on, or kind of what's the next plan of action there. That's really helpful when you talk to so many people in such a big system, to just have somebody's name. Oh, hey, I talked to, Susie last week, and she mentioned X, Y, and Z. I just want to let you know I submitted those things. What's the next step? So I would say just have a dedicated Medicaid notebook.
Okay, I think that's really helpful. I think that would definitely help people, keep all their thoughts and who they've talked to and what calls they've already made in order. And one more thing I wanted to ask, and this is a question I get a lot: does Medicaid or Medicare cover any sort of funeral costs?
No. So I think that's another kind of myth or misconception, is that Medicaid or Medicare has some sort of death benefit. There is not a death benefit. There is a federal death benefit unrelated to Medicaid or Medicare, and it's pretty minimal. I think the most I've seen someone receive from that is about $200, and it's quite a ways past the funeral date, and so they still had to have costs up front. So there isn't a death benefit there.
Okay, so it sounds like it's really important, especially if you're needing to do some spend down to be eligible, to go ahead and make those plans ahead of time.
Mm-hmm.
Okay, so that's very, very helpful. Is there anything that we haven't mentioned that you guys think is important for us to get across today to folks?
I think the biggest thing for folks, we've talked a lot about our elderly populations and our dual eligible populations. I think the biggest thing for folks is, if they're questioning whether or not they even are eligible, if there's a chance, I think the biggest thing is to fill out the application and see, to take the chance and to apply. There are so many resources available in various parts of the states, whether that be just going to the state of Missouri website, which you can actually see down at the bottom here in the scrolling banner. They actually have a very easy step-by-step guide that'll let you know if you're eligible, and then we'll actually trigger you on to fill out the application. You're not going to fill out the application for no reason. If you make too much money, if your household income is too high and you fill it out, they're not going to say, oh, sorry, too much income. You're actually going to be told that. So you can look up these stats very easily and know in advance. If you think, if you're close, if there is even a chance that you might be eligible, apply. Always apply. That's what I tell people. Don't ever be worried. Don't let the process scare you, and don't let it ever feel like it's too much work. It is work, but it's absolutely worth the payoff. And something to be said for folks, I know there's a lot of individuals out there that probably have applied with Medicaid expansion in the state of Missouri and are still waiting on their insurance cards, still waiting to even hear from the state of Missouri. The federal government actually stepped in August 2nd, I believe, or middle of August this summer, and gave Missouri very stern timelines and provided them help and funding to get these applications processed and taken care of. So they have stepped in, and they're providing the help that Missouri needs to get these things taken care of. And by things, I mean the backlog. So that is going to be taken care of. So don't let that worry you. It's coming. They're fixing those issues and fixing those problems. Missouri just wasn't quite prepared in all of the ways they should have been, because I just think they underestimated the need of Missourians. But now that they're here, they've got it taken care of. And again, I just would encourage everyone to apply that thinks they could be eligible. And that goes for anyone, pregnant women and children especially.
I would say that too, Cara, that, just go ahead and apply if you, like I said, if you're struggling to pay some medical bills from the last 3 months, that's something that they could help out with. But the first thing you have to do is just see if you're eligible and try it out. If it turns out that you're not eligible, that still puts your information and your name in the system for the or for the state of Missouri. And so maybe you're not eligible specifically for Medicaid, but maybe there are other benefits or other things that you would be eligible for that could be suggested to you. And you being in the system is the first step. So, sometimes it's a simple matter of, paying your things down. Sometimes it's, getting help with that last 3 months of bills. But I agree completely, Cara. Just go ahead and apply or see if you're eligible. The website, in the past has not been the most user friendly. It's kind of been tricky to navigate, but there's really been a lot of improvements on that. I think just since we've become a more tech savvy society, and the state is saying we want to go paperless, we want to do these things, and so they kind of had to put their money where their mouth is and beef up the website. So that's definitely been a plus. It's much easier to navigate now.
Well, and to also piggyback off what you were saying, to talking about what people need to document and keep track of, when I was a CAC and a navigator, I always, besides my personal documentation, I sent everybody with a folder of everything that I had done. And that was kind of their personal little notebook or folder that they would keep. And their little journey in the navigation world is how they would get their health insurance. And that way they would have it, and it would say everything that we had done that day or who we had spoken to, what I had done, so they would know. I recommend everybody do that for themselves too. But even with the internet and you're filling out this application, write down the day and the time that you did that, because it's important to know that your application was processed and sent through, and make sure that you get your confirmation screen, make sure that you follow it through all the way to the end. And if there's any question or any doubt, call the state of Missouri's number. And the state of Missouri's number will be available on the website of the application. It's very simple to get to. Again, if in doubt, call the state of Missouri and confirm. Always write it down, always document everything that you do.
Yeah. And Cara, really, that goes to show that this can be a kind of a cumbersome process. And so I think I really appreciated what you said earlier about having somebody there with you to kind of help you through this.
Absolutely.
I think the process of applying, or even, you have to reevaluate each year to make sure you're still eligible. And sometimes those things can be intimidating. Really, that's not unlike any other kind of insurance. You still have to redo, resubmit your information for other insurances as well. So having that support person there, it just kind of helps unload a little bit. And so it's not just on your shoulders.
Right. And,
as a licensed navigator, where would people find you?
So I actually worked at a federally qualified health center. So those are typically at a hub in a rural community. I worked at one in Audrain County. There's one in Boone County, Audrain County. There's several here where I'm currently located in St. Louis County. There's one in Kansas City, I believe, in Platte County. Joplin. They are spread throughout the state. So they are everywhere. And if you type in, you're just going to do a Google search and you type in Missouri, FQHC, and your zip code simply, or your city, you're probably going to be inundated with a list of your nearest FQHCs. And you would be able to find one of those health centers. And their primary goal is to service individuals that either are low income or don't have insurance. But one thing that a lot of people forget is that they will happily take insurance too. So if you have insurance and maybe you just don't have access to a primary care provider because you are in a rural area, or maybe the primary care provider that is in your area is at capacity, call your FQHC and see if they have access and they can see you for simple healthcare visits, or that navigator or their CAC can actually help you with these kinds of questions. They can help with simple insurance things. They can help with Medicaid, Medicare most of the time. And if they can't help you, they're going to get you to the right person, and they'll be happy to provide the information to help going forward too. So that's one thing to note. And Christi, you kind of triggered a little bit of information in my head when we were talking just a second ago. Christi was talking about, process, and we've been talking about all these things and documenting. Kind of going back to keeping track of things, and something that I did, keeping track of things. One thing I always like to tell people too, we kind of get in the habit of always having our jobs or employers, if we've had insurance before, update our information for us. Or when someone, an advocate, is helping us, they're putting in that information. So there's kind of this third party kind of disassociation that we kind of lack because we're not doing it ourselves. One thing I really want to stress to individuals when you're applying for Medicaid is please, please, please if your address, phone number, email, name, any of your contact information, anything about who you are, where you live, how they can find you changes, please contact the state of Missouri and update it, because that absolutely will affect your Medicaid. If and when they are updating information for you and they cannot verify that you still live at your address and you still live in the state of Missouri, they will cancel your Medicaid. And they give a certain window. Usually it's 60 to 90 days. Sometimes it's 30 for a simple verification where you sign off on a form. But it's a very serious deal because, like I said, and most people go, well, why would they do that? Well, when you have insurance that's through HR or through your benefits plan at a company, your HR is sending that information off in a file, usually digitized. Some folks, I'm sure, still fax it in this day and age. But Missouri Medicaid has to do all that by hand. So you really have to help. And if you don't have someone advocating for you, you have to be your own advocate and try your hardest to get that information to them. So, Christi, thank you for triggering my memory on that, because that is one big thing I think people often forget about that can be a huge barrier. And people will get an envelope saying, you've been unenrolled. And usually it's at the worst possible time. Someone has just had a baby, someone has an ear infection, your child just went to the ER, and you're worried about the medical bills. Don't panic. You will get Medicaid again. You just have to go through some process. It's not an issue. Better to deal with it before you get there, but it can always be handled. So again, rely on those advocates. Reach out for help if you need it, and just try to kind of look out for those things before they come at you. So.
That's very, very helpful. And I can kind of just hear people that might be watching this right now going, but wait, Cara, I haven't had to redo any of this information in years. And that's because we've been having a public health emergency, right? So they haven't been asking everybody to do that. It's been automatic renewals. And that's going to end in April. Is that right?
That is correct. So that public health emergency, as of right now, is ending in April, assuming nothing changes, which I hope that stays the same, and that is the case. So shortly thereafter, individuals are going to be getting a lot of information in the mail, not just individuals on Medicaid, but individuals that are receiving a lot of state services, whether that's food stamps, TANF, temporary assistance for needy families, individuals probably with Head Start. I mean, I would guess a plethora of state federally provided services are going to be sending out documentation and flooding everyone's mailboxes trying to update their systems. So biggest thing to kind of head that off is to have your documentation ready, have your proof of address, go ahead and if you can preventatively update your information with the state of Missouri right now while they're slow. Notice years here because that's a relative term with insurance companies in the state of Missouri. Slow is always a hard time. Go ahead and call them. Give them a good mailing address. Give them a good email and a good phone number, whatever that might be. Let them know how to reach you so they can reach you when it comes time, because that's going to be really vital that you don't lose your benefits. Now, I'm not for sure if the state of Missouri is going to give a longer window for processing. If they do, the angels in the Missouri Medicaid office hear this. I would love that for everyone. I would love that for them because they're going to be processing those applications. I doubt it, though. I imagine they have some red tape that they would have to really cut through for that to happen. But that's going to be a huge issue for everybody. And that makes
you can also update your information or even just check to make sure it's okay, that everything is in there okay. You can also do that online.
But again, check it online and then call to verify. For our folks that don't have access and don't have an advocate to log in, you're going to have to call. And that's going to be, don't be frustrated. Just hang out on, on hold and wait. Chat with someone.
They have, I don't know if it's new. I don't think it's new. They have a feature that you can have them call you back.
Yes. They give you like a certain time frame to give you.
Yeah, we'll call you back, in so many hours or something like that.
Yeah, and that one, I believe, from what I've heard, that is pretty accurate.
In my experience, it has been a really useful feature.
Good. That didn't used to be a thing. It used to be you would sit on the phone and just go about your day as the whole music was on. So that's wonderful that they're catching up and doing these things for people. I think it's, there's still things that are, going to drive people crazy, but it's important to remember how far the state of Missouri has come and how much work these folks are doing to make sure that applications are processed and how hard they are working. So.
All right. Well, that seems like a really good place to end it. I want to thank you both so much for joining us today and for giving us all of this fantastic information. So you guys can go to the website that's scrolling on the bottom of the screen right now to apply for Missouri Medicaid or to check the status of your information. It's always a good idea to call if you can, and keep a notebook so that you can keep track of everything that you've done already. Thanks everybody so much, and have a great day.